Moving to different surfaces using a sliding board will be explained as a broad overview. If you need different accommodations or a different type of board for safety purposes or different levels of assistance, please speak to your primary physical therapist.
You need to line up your wheelchair parallel to the bed or at a slight angle, so you're at the right angle to transfer over. If you can't transfer your wheelchair yourself, position it, you need to have someone assist you with that. Next step would be to move the armrest out of the way, all the leg guards, that kind of thing. Again, if you can't do that yourself, you need to have someone assist you. You need to shift your weight over to that opposite side, put your weight through your arm, stabilize yourself. If you need assistance with that also, the person needs to be in front of you. They need to, have their one arm on that side supporting you and then slide the board under your thigh. You're gonna push as much as you can through your arms. Look down in a way, they're gonna lean you forward, help you lift, and slide your bottom towards the bed. Position your wheelchair either parallel to the Commode chair or at a little bit of an angle. You want to have the individual who is assisting you drop the arm of the Commode down. Next, you would want to take your seatbelt off. You want to lean again to that opposite side. They're going to lean you over a little further and slide the board under that thigh. Once you're forward, you're going to look down and away from the Commode seat so that your bottom will slide towards the Commode seat. The more you practice it, the easier it'll become, the more smooth it'll become. You'll feel more comfortable coming forward, you won't feel so off balance, and it should become easier. Once you get into the bathroom, you need to position your wheelchair parallel to the shower bench because it's gonna be a straight transfer sideways. With that one, you don't really want to angle it a whole lot because, especially when you're going to be coming back out of the shower, you need to balance yourself on the opposite arm, swing the armrest out of the way or remove the armrest, any calf pads, those types of things that you might have on your wheelchair. You need to remove your seatbelt. They're going to slide the board under for you. The person who is assisting you then needs to be directly in front of you because they're going to help lean you forward. You need to look down and away from the side that you're going to be transferring to. One arm is going to be on your armrest, the other one's on the board. And in one motion, you're going to push down and slide your hip towards the shower chair.
Depending on the patient, some are able to just bring themselves right up, others want to have something nearby. You're going to turn your body so that you're sitting on an angle towards your chair, bringing your legs, each one with you, make sure they're close by. Bend your knees up at this point. Some people need to hook their knees and kind of keep one hand on the chair. If you need to, you can either bump right up to the foot plate, so you're just a little bit up off the ground versus going right all the way up. You're going to either reach with your dominant arm, so whichever side feels stronger at this point. You're going to either hook the armrest, the wheel, and you're actually going to push through your arms and get your bottom up. You're going to wheel them, kind of just pulling them closer with the door as wide open as you can get it. You're going to have the actual passenger seat pushed all the way back, as far back as it can go. You're going to have the patient put their feet down on the ground. You're going to remove the armrest. You're going to scoot them towards the edge of the seat. Have them lean over so that you can actually slide the board under their bottom. You're going to have the patient lean forward, so that way when their head is forward, you're going to be grabbing right around the buttocks, hips area, and you're going to help slide them in. You're going to get as close as you can to the curb step at this point. If they have anti-tippers, you're going to either remove those or flip them up out of the way. You're going to push down through the handles on the armrest. Some people will also put their foot onto the anti-tipper bar. You're going to push through and you're actually going to pop the front wheels up. When you're going down the curb step, you're actually going to back up to it. You're going to step down carefully. Once again, either remove the anti-tippers or flip them up. Hands on the handles, you're going to slowly roll that back wheel down off of it. At this point, your front wheel should be up in the air. You're going to keep backing up just a little bit and then lower the front wheel slowly down to the ground.